sorry I'm late, but thank you all for waiting. My name is Lisa Thompson Bennett with the Illinois Attorney General's Office. I think I was privileged to speak with a few of you the last time I was here. We talked about housing scams. So today we're going to talk about scams again, our favorite subject, right? And we are going to talk about healthcare scams. Okay, so a lot of changes in the healthcare arena, just like everything else. So we're going to just talk about a few things that we tend to find are targeted towards our seniors. Now, I was fortunate enough to have one of the audience help me pass out a fabulous booklet that you should have received called Every Cent Counts for Seniors. Okay, this is a wonderful publication. The Attorney General put it together. We actually have 3 versions, the senior version, which is the largest, and then we also have a regular everyday one, and then we also have a version for youth, because there are definitely specific scams that are targeted to different age groups. So we're going to talk about a little bit about healthcare and some of the scams that we've seen through that, particularly regarding seniors. So one of the first ones that was quite popular, it's kind of died down a little while now, was the $299 Medicare scam. Now that was several years ago, and we seem to be able to have kind of thwarted that a bit. That involved companies that were trying to get people to sign up for a Medicare card, or so they claimed, that would allow you to buy your medicine from Canada at a discount. And it was $299, and it was supposedly a Canadian or some other entity other than the United States Medicare program. We had a lot of calls about that. I'd say about 5 or 6 years ago. The FBI got involved in the FTC, and we really saw that die down. I think that was around the time that there was a lot of talk about ordering pharmaceuticals from Canada in general, when they were saying that the cost of medicine was getting so high, and some states had decided to start partnering with other countries to get their medication, and that's when we started seeing a lot of scams regarding the purchase of a presumed Medicare or Medicare-like card for another country. Has anyone heard about that, or have anyone that was impacted by that? That kind of died down. Now the other two are more recent, and that's regarding the phone, which is why the second handout you got was just hang up, because most of our scams that involve seniors, particularly with health care, deal with someone calling you on the phone. So the most recent one that we get the most complaints about probably is involving durable goods. The pattern is that it tends to occur shortly after a doctor's appointment. And then you get a phone call, and there's someone that says, you know, I've got this great offer, and we can give you it's either a wheelchair, often insulin, or the test strips for diabetics, catheters, etc., at no cost to you. Okay, so what does at no cost to you mean?
It's not true.
Well, it's true, it's no cost. It's too good to be true. At no cost to you, 99.99% of the time means that someone else is going to pay for it. So maybe you don't write a check, but someone is going to pay for it. And in this case, with these durable goods, it's always going to be Medicare. Now, we are unclear as to why it seems to coincide with doctor's appointments, but the pattern usually is within a week or two of a doctor's appointment, a lot of these scammers call. So I don't know if it's because the records have been put into the system. We're not really clear, but we're still investigating that. But in the meantime, what we want to warn you about is these people that come and say that they're going to give you these products at no cost to you. Every time they're going to use Medicare, they're going to bill Medicare. So it's not the check you're writing, but Medicare is going to pay for it. Unfortunately, you don't know what they're going to charge Medicare for. And in a lot of Medicare fraud cases, it's either thousands of what you only got one of, or there's a lot of other added items that you did not receive yourself that end up getting billed to Medicare. Okay, so a few things that we recommend: you get your quarterly summary from Medicare. Examine that closely. Take a look at that. Make sure that everything on that summary is something that you received yourself. Okay, that's a good way to keep track of it. If you get that phone call from the durable goods people, whether it's a wheelchair or the scooter or whatever they're going to try to give you, we recommend that you thank them very much politely, hang up, and call your doctor's office. Okay, if you really need those things, I would recommend that you talk to your doctor's office and let them refer you to someone. But don't order anything over the phone that requires you to give any of your personal information. Because if they are a vendor, they're going to want your Medicare information, which includes your Social Security number, your address, et cetera, et cetera. And then that can lead to a lot of other issues aside from just the durable goods they charge to Medicare, because then you find yourself being a victim of identity theft as well. So it usually starts with the phone call. You know, our general rule of thumb is if anyone calls you, even if it's someone you're expecting, and they want a lot of personal information, it's always best to hang up and call back yourself. That way you are 100% sure you're talking to the entity that you really want to speak with. There are times that you do have to give some of your personal information over the phone. We're not saying don't do it, but we're saying be careful. And ideally, you give that information over the phone when it's a call that you have initiated, not when someone calls you. Because in addition to all of the other issues and scams that we see, of course, and it's called cramming or spoofing, it's where scammers change the caller ID information. So it says, you know, they're from Medicare, or it says they're from ABC Medical Goods, but that doesn't necessarily mean that that's true. So again, even if it's something you're interested, it sounds like a great deal, and you know, I'm interested, still say, you know, give me your number and call them back. Verify. I think we talked about this last time. It's something that we say a lot in our office. If in doubt, check it out. Give us a call. If you're not sure it's a legitimate company, you can always call us and ask us. Yes, ma'am.
A time ago, they were advertising on TV that you could get a motorized scooter.
Mm-hmm.
Because they're not doing that anymore now.
They are not doing that anymore because that was, well, as I mentioned, a lot of laws changed, Medicare included, but that was a legitimate service, not necessarily something that everyone that saw it on television necessarily needed. And in some cases, in most cases, if you need a scooter, your doctor is going to recommend it, which is why we say talk to your doctor's office. That was a legitimate company. They're still around. They're not advertising on TV because I do think that, you know, we're trying to put more safeties in place for seniors that want to order something. So in other words, I guess that was big business for a while. I don't know if you've seen in the news, there's been a lot of Medicare fraud arrests and busts, and more often than not, there is a doctor involved and they're doing the billing. So I think at this point, the scooter is still a viable option, and that company is a viable company. However, I think you're going to need a referral from your doctor to be able to get that scooter now, which is why I think they had to change their marketing. So 99% of the time, the Attorney General's office is not necessarily to put a company out of business, but to just make sure that their business practices align with our laws. So I think in that case, originally you were supposed to call them and you did all the paperwork over the phone and they handled everything else from there. Well, now we have another step, and you're gonna have to have a referral from your doctor. And I think that's where it gets started. So even if you get the information, I do believe that at some point a doctor is going to be involved as well. So if you're interested in the scooter, talk to your doctor about it. You're not interested, okay. But that was a good durable good. I think we all saw those. And I think there was a run on the catheter commercials for a little while too. Still on? I haven't seen that one for a while, but okay, so that's another one. And it's a permanent catheter, or you know, they'll deliver it. That's
Whatever kind you want.
right, absolutely, and they'll deliver. That's the other goods and services call you tend to get are the ones that will bring your medication to your home. They'll bring your supplies to your home. They'll deliver at no cost to you, right? Okay, so we know someone's paying for it. Maybe not you out of pocket, but your Medicare, and then you may be eating up your benefits with those charges. Yes, sir.
I don't know if everyone is aware of the fact that the township collects medical apparatus, canes, wheelchairs, walkers, and these are available to all citizens in the township.
Okay, so where would they go to participate in that? Through the police department?
Go to the township office.
Okay.
Tell them what you want.
Okay, well, see, that's great. So go to the New Lenox Township office and you can get some of those supplies at no cost. So that's great. Thank you very much for sharing that with us.
I was riding my bike one day, coming through, and I saw something in the garbage, it was a wheelchair.
Wow.
So I drove back and got the
Okay, okay.
put it back together and gave it to the township.
Absolutely. So repurposing is great. So more than one place to go. Again, free is always the best price, to me at least, but again, at no cost usually means someone else is going to pay for it, so be careful and make sure that you check your summary quarterly. I do have some resource guides. We have all of the numbers that you would need to call. Again, we recommend that you initiate those phone calls as opposed to talking on the phone and giving people information. Door to door, another healthcare scam. Same services, durable goods, but they're at your door and they're knocking on the door and they want you to sign up for something. What would you do if someone is at the door that you don't know?
Don't answer it.
Don't answer it. That's good. And they keep knocking, what do you do?
Call 911.
Okay. Yes, ma'am.
I was, we were here at a meeting one time and we were told, like you could just have a cell phone by your door and just pretend you're talking to somebody or yell out for a man's name. You know, just to make them think someone else is
It makes 'em-
besides yourself.
Absolutely, and that's a great practice. Now, we recommend that you just talk through the door. If there's a glass or window that you can look through, great. If there's a peephole, great. If you can't look out the window, still talk through the door. Okay, especially if it's no one you're expecting. Okay, and if they say, we got this great deal and it's only today, that's also a very common scam. It's always got to be something you've got to do right now. Right this second, can't wait another minute. So be very careful of those things. Has anyone had anyone approach them, call them, mail them, email them about any medical services or goods? Nothing on the internet? How many people are on the internet? All right, that's pretty good. Facebook? No Facebook? Not one Facebook person? Okay, I was gonna say, I'm bad too. You know what, I cheat. I do birthday and Christmas and I don't go on the rest of the year, but okay. Occasional Facebook, okay. Because, and the reason why I'm asking that is because a lot of these healthcare issues that start out as scams and they bill Medicare can also very quickly turn into an identity theft issue. So you gotta be careful of that. The internet is a wonderful tool, but it can be a terrible place if you are not careful. If you're not familiar with the computer, be careful of the little pop-up things that come on the screen, and you know, you're trying to close it, and before you know it, you've signed up for something that's attached to your email address or something like that. So be careful on the internet. It's interesting, it's wonderful, but be very careful. If you do any kind of business on the internet, be careful that you're not using your mobile phone, a smartphone, or an iPad, a tablet. Use a regular computer, either a laptop or a regular desktop computer. Because when you're on your mobile phone or you're on mobile service, that can be captured pretty easily as well. Okay, any questions so far? All right, I'm going to keep rolling. Did I have a question? I'm sorry.
That I didn't realize that about the smartphones.
Yes, you do have to be careful. And you know how we found that out was very interesting. Now, part of our identity theft presentation talks about your credit report. Now, you know, everyone is entitled to a credit report for free from all three bureaus every year. What we recommend in order to track your credit and make sure that nothing is erroneous that's on there is, instead of getting all three at the beginning of the year, we recommend that you space it out. So maybe one in January, one in maybe May, and then another one in November or so. That way you can see all three bureaus and kind of space it out periodically. But the way we found that out is annualcreditreport.com is where you go and get the free credit report. I was on an iPad that I had gotten about a year ago, and I was going to order my my free credit report last year, and I got on my iPad and it said, we see you're on a mobile iPad. Are you sure you want to use this service?
Oh, wow.
Yes, so I was like, wow. And it said annualcreditreport.com recommended that I use a regular computer. So I went back to the office, I talked to our high-tech crimes division, and they were like, oh yeah, you know, you really want to be careful with mobile phones and iPads. Now, and not to use a brand, any kind of tablet. But there are two versions. You can get the kind that uses your mobile service, and you can get the kind that uses Wi-Fi or wireless internet service, okay? If you're at home and you're using your secured internet service, that's much safer. But even then, you should be careful. If you're at home and there's a regular computer, that's better, okay? Any questions about that? All righty, so I'm going to talk a little bit more about a couple things that really get to us, and that's called what's in your wallet. Now, this started because, I don't know if you remember, a long time ago, everything had our Social Security number. Well, not everything. You had a Social Security card. I remember my parents applied for mine when I was about 12 or 13. You're not born with one, you're not given one, or you weren't then. Nowadays, you pretty much get it as soon, as you're born, okay? That is interesting, but we find a lot of young people are victims of identity theft and they don't know until they're young adults. When they get ready to go to college or apply for a job or something like that, that checks their credit, that's when they find out that they've been a victim.
Should you check credit on a little one?
You should. If they have a Social Security number, they are entitled to the free credit report every year just like anyone else. So you do want to be careful. Now, we do find a lot of times that relatives are often the culprit when it comes to identity theft too. So, we've had issues where a family has some hardships and their credit is ruined, but there's a junior, has the same name and, different Social Security numbers, so let's use junior's information. And they start a whole new credit file. Or, someone in the family that has the same last name has stolen that information. So again, you want to be careful with your Social Security number, but the reason why I brought that up is because it used to be a pretty common thing to have it on everything. It was on our driver's license, it's off of there. What's the one card is still on? Medicare, yes, and we are trying diligently to get it off. We do not want your Social Security number on there, okay? But in the meantime, it is, and you have to use the card.
I had heard that you should make a copy of it.
Mm-hmm.
And just wipe
Scratch
out
out.
the last 4 digits.
Mm-hmm.
Unless you're going to a doctor or something where you need it, but just don't carry it with you.
Right, now that's,
Yeah, scratch out those last 4 numbers.
and that's actually what we recommend too, and it's called What's in Your Wallet, and it is in your Every Cent Counts book. And that is exactly what we recommend, is that you stop carrying the actual card and make a copy of it. And scratch out those last 4 digits and make a copy of that. So you go to the same doctor's office, why do they need to see the same card over and over and over? Because they make a copy, most of them, every time you come, so why do you need to make a copy of the same card? And 99% of the time, they really don't have to if you just question them about it. Yes, ma'am?
Yeah, that was on my list because I've been at somebody's office and they were questioning why I blocked it off.
Mm-hmm.
Because they needed the number. And what do you do then?
Well, you should be able to verbally give them the number. Was this the first time you went to that doctor?
Yeah.
Okay. They should be able to match it up when you verbally give them the number.
Okay.
So that's still fine. You can still use that. Even if they insist on a copy, they can take a copy of that one and you can verbally give them the information. I don't know if you remember some years back, probably about 3 or 4 years ago, there was a huge theft ring that was busted at a Chicago area hospital. And people that were patients in the hospital, things were, showing up on their credit cards, all kinds of big purchases. They couldn't figure it out. And at the end of the day, it turned out that there were a couple of people that worked in the hospital, went through the files, pulled people's information, either created or applied for and opened phony credit cards and went shopping. And had a blast. I mean, not groceries and fur coats, big screen TVs, all kinds of fabulous things, really big ticket items. And you know how they were caught? We caught them on Facebook, modeling the fur coat, showing off the new TV. So they were brilliant, right? So let's steal all this stuff and go on Facebook. And that's how they got arrested. And that's how they inevitably got caught. Showing it off on Facebook. Yeah. Yes.
That's how they caught her.
Yes.
Yeah.
So Facebook can be fun, but I will tell you, our office, when we're looking for someone that we want to talk to, not necessarily a suspect, but maybe a possible witness, Facebook is the first place we go. Employers look at Facebook a lot.
Yes, they do.
So
Colleges look at Facebook.
colleges
a
look at
lot.
Facebook, and you want to be careful what you have on there. You know, and you also want to be careful who can see your profile if you're on Facebook. So make sure your page is private, only for friends and family, because the public will definitely go in and steal a lot of information, and they can build a nice little file and create a whole new person just with the information they pull off of Facebook. Maybe not your social security number, but they have the names of all of your relatives. If you're tagging pictures, they know you're out of town, they know you're on vacation, so you want to be careful with things like that. Yes, sir.
There's several commercials going out now. How your credit card is compromised. I mean, not credit card, but your social security number is compromised. And they show where the clerk at a doctor's office is copying the number. They also show clerks in the restaurants copying the number.
In a restaurant, copying the credit card number. Okay. But yeah, I mean, you want to be careful with your credit card. You want to check your statements as often as you can. That's a little more difficult to steal, although the magnetic information on a credit card is not that difficult to steal. You remember the Target fiasco? That was was at the scanner. They were stealing information off the magnetic strip from the scanner. So that can happen, absolutely, which is why we recommend copying your Medicare card instead of taking it and letting them make a copy every single time you go. Maybe the first time they may question it, but you should be able to verbally give them your social security number, and that's enough. But if it's the same place you go all the time, there's no reason for them to really copy that same card every single time. Unless something has changed, it's the same information. So we really recommend that. Also, in talking about what's in your wallet, you want to be careful. You don't want to carry your actual social security card, ever. Ever. Just lock that up and throw away the key somewhere, and hopefully you remember it. But don't carry that with you. We also recommend that you don't carry large sums of money, cash, for obvious reasons. And be careful with your credit cards. If you have a really high limit on your credit card, you don't want to carry every credit card you own. You know, maybe have one. But you know, if it's a credit, if you have like one good emergency card, maybe an American Express with no limit, or just one high limit card, that's okay. But don't carry everything you have at one time. That's a good way to get your identity stolen quickly. And then there are magnetic card readers. Not hearing about them as much as we used to. I think the internet has just taken off so much that a lot of the more manual ways of getting information are not utilized as much as they used to be. Not to say that they're not used, but just not as often.
Why is it so hard why does, to me anyway, it seems like Medicare is so far behind? It gets abused so much. And I don't understand. In the age of technology, I can't, some are gonna slip by. Okay, I give you that. But I don't get all the money that they put out, and it's doctors are ripping them off left and right.
Well, you know what? I think the problem is that technology is just growing much faster than law enforcement has been able to keep up with it. You know, the internet has opened the globe to everyone, you know, where you could, you know, a long distance call cost a lot of money, so people didn't want to call long distance. You can call anywhere in the world for free on the internet. You know, technology is way ahead of everything else. So Medicare is a great program, but with technology advancing, it's not as technologically savvy as it should be. So that's another thing our office is very much advocating for, is a federal agency that oversees the internet. Now, you know, as things change, we've had to create other agencies on the federal level, the Department of Labor being an example, the Veterans Affairs. Our latest one was the Homeland Security, Consumer Financial Protection Bureau, and we think we need an agency that oversees the internet at this point. At this point, we're at, you know, we have a division, FBI has a division, everyone has a division, but there's no, you know, central place to go and get all of this. And I think that input would help a program like Medicare kind of catch up to the 21st century. And I do think, yeah, it's an older system, you know, but technology changed.
I had a couple of friends tell me they've called Medicare and said, I'm being charged for something I didn't get. They said they don't care. They don't care. I called, they don't.
Really? They said they didn't
honest to
care.
God, they said they don't care. I called and reported it, and they could care less.
Okay, well, you know, I would ask that you call our office, and I'll give you the resource number. If you're not getting what you want out of Medicare or any other number, you can always call our office. Sometimes it depends
Not
on,
that they're not paying the bill, they don't care, they overpaid.
well, see, that's the issue, and that's what we want to stop, because if they're paying money that, you know, tax dollars and your pension and every Social Security and everything else for services that don't exist or things, then that's depleting,
Yeah.
you know, finances and services that would be available to someone else. So we're very interested in that. We also have a senior citizens hotline that you can always call and ask us any questions, and also report that as well. And it's also on the resource sheet that I'll give you.
Good.
Any other questions?
Not many yet.
Mm-hmm.
I've had 2 incidents on my Discover card where I have had problems. One of them, there were some charges to a game website.
Mm-hmm.
When Discover card took care of it,
Okay.
they credited me,
Mm-hmm. And most credit companies will do just that.
double billed me.
Mm-hmm.
I called them up and told them, did it twice.
Mm-hmm.
I didn't get any real response. They said, we'll take care of it.
Mm-hmm.
But it never showed up.
Okay.
I called Discover, they went to work on it, they didn't get anywhere.
Okay.
So now I'm talking at least to the Secretary of State's office,
Mm-hmm.
and at least let them know what I've run into.
Okay. And so Discover did not correct the double billing?
No, they couldn't, they didn't want to.
They didn't want to, because they certainly can.
Probably $10 or $15.
Well, you know,
Get by with that, but they did change the number on my credit card.
okay, but, okay. I would still recommend now, credit card companies are national. So while we can take a complaint, we will send it to the Consumer Financial Protection Bureau. So that's another agency you can call and make a complaint about any national provider. So any credit card company, because if they double billed you and it was a mistake, they should give you the money back. Now, they don't want to, but they certainly can do that. So I would recommend that for sure. Last but not least, I will say on healthcare, if you ever have a billing dispute specifically to any kind of healthcare related matter, we do have a healthcare bureau, and that's what we do. So if you're overcharged by a hospital, by a doctor's office, I add to my phone, and I'm just going to act like I don't hear it. But if you're overbilled or you have disputes with a hospital or any kind of billing, our office does handle those disputes, and we will gladly help you get those charges and get that bill corrected. Okay? So any more questions? Yes, ma'am.
I'm not sure if you know the answer. Do not call. If
Do
you,
not call.
Sign up to do not call, why am I still getting some stupid call?
Why are you getting, well, you know, that's a great question. And actually, just hang up, I'll tell you what happened. Well, when Do Not Call first was created, it was a great idea, and everybody jumped on. And they said, oh, it's going to be good for 5 years. You don't have to renew, right? Well, didn't quite work out that way. So then we started saying, well, maybe every other year. And we said, maybe every year. So we're at the point now that we recommend that you renew your Do Not Call for any numbers that you have on that list, including your cell phone number, every spring and fall when you change your clocks for daylight savings time. So we say every spring and fall, renew your Do Not Call. So when you change your clocks, re-up it. Same phone numbers, and that will diminish those calls significantly. But charities and political organizations are exempt from the Do Not Call list, so
Oh, they are.
charities and political.
Political, yeah.
So those calls you're going to keep getting, unfortunately. But
Right now, all the political.
yeah, so they're exempt from Do Not Call. Hi, Kathy.
Repeat this so the camera can hit it. I talked to Officer Davis today.
Mm-hmm.
She said she talked to an employee of a local bank, and that customers of that bank had come and complained to him and said someone called them and the caller ID gave the bank's name.
What we talked
But
about.
Okay, it wasn't. So it's happening here in New Lenox. So
Be careful. Well, see, Kathy, now perfect timing. What did we talk about? Okay, the spoofing is what they call it when they change the caller ID and they pretend to be from some place that you're familiar with. In this case, the local community bank. We've gotten a lot of complaints about, you know, Social Security, FBI are another couple of popular ones, but they have used a computer program to make your caller ID show a name that you're familiar with. And I'm going to assume that they ask for some very important personal information, your account number and Social Security, etc. So what did I recommend earlier? You hang up and call the bank yourself. So that's perfect timing. Wow, thank you, Kathy. A perfect example of those phone scams. So yes, be careful. You cannot trust the caller ID like we used to. Okay, and even if it's someone that sounds legitimate, hang up and call them back. Absolutely. Yes, ma'am.
Yeah, just the other day, I got the caller ID said Chase Bank,
Mm-hmm.
and I answered because I do have something with Chase. The guy says, "Oh, Joan, I'm following up on a call Scott made, and Scott is my banker."
Mm-hmm.
So, I mean, he had a lot of personal information,
Mm-hmm.
but then he started asking
For
about
information.
my account number.
Okay, and what did you do?
I hung up.
Perfect. Very good. Wonderful. Yay. That's what we do. Hang up and call the bank, and you should call Scott and tell him what happened. Okay?
He wasn't in that day, but.
Yeah, but let the bank know, and you can always call us too, because we do want to know about where these things are happening. So I'm going to get some more information from Kathy about that.
Could somebody put their Chase number on the caller ID to make a person think that that's what
Yes,
it is?
that's what you.
Well, right. I mean, it may be an 800 number. Anybody can get one. But if it says Chase Bank, you think it's Chase Bank. If it says FBI, you're going to think it's the FBI. That's an issue. Well, if they call you and they're asking for personal information, say, you know, I'm sorry, I'm going to have to call you back, and hang up. And then you call your bank or Social Security or FBI. I guarantee you, Social Security will never, ever call you and ask you for your Social Security number. They do everything through the mail. You know, you can order something, they're going to mail it to you. They're not going to email it. They're not going to do anything. It's coming in the mail. Okay, that's how they work, and a lot of federal agencies do the same. Okay, so I am going to take any more questions. I'm going to wrap up.
I got a comment. I don't know who puts it together, but this one was sent out by our state senator,
Mm-hmm.
and it's a senior citizen's handbook.
Okay. Wonderful. Well, now you have two, because now you've got the Attorney General's handbook, which is our senior Every Cent Counts.
Yes.
Okay, so I am going to thank you all for being such a fabulous audience. I've got more information on the side, and thank you very much.